Okay, so this skill that we are going to show you today is a PICC dressing change. Now, there's a varying degree of what an LPN can do with PICCs. But as far as this course goes, we want to teach you how to change out this dressing from a PICC and change out these two ports on the PICC as well. We won't get into infusing any medications or anything through the PICC, as we'll cover this stuff in later labs as well as in class. So for today, we're just talking about changing this dressing around the PICC line. To be sure, this is actually a sterile procedure. Everything underneath this dressing right now, the PICC insertion site, the locking system, and anything up to the edges is all sterile inside. So we are actually going to do a sterile dressing change. There's a few things that may differ from person to person, but we'll try to address those as we come up on those. Okay? So, first of all, I'm just going to put on regular gloves. Just to be prepared here. Now, we're going to have to gather all of our supplies before we put on our gloves, but I'm just going to show you what I've already gathered here. We're going to need a pair of sterile gloves, fit for your size. I'm a 7.5. You're going to need a mask. You're going to need a sterile dressing tray, blue pad. You're going to need a measuring device, pre-filled sterile water or saline, chlorhexidine swabs, some lure locks here, some caps are just in case. You're going to need a stat lock, a large tegaderm, and some alcohol swabs. It is really important for you to know that this PICC dressing will be kind of difficult to take off. The dressings themselves are very sticky. So one of the first things we are going to do here is we are going to measure. So we are going to measure from the insertion site itself, which is right here. And here's where two different schools emerge. Some people will have you measure just to this point right here. Others will tell you to measure to the top of these hubs. Just make sure that whichever one you measure from, at the end of your procedure, you measure there again. So for me, I'm going to measure from the insertion site all the way down, making sure I hold it, all the way down to the top of my lure. And there I have 5.5 inches. And I'm going to remember that that is 5.5 inches. The reason for this is we do not want this PICC to be pulled out or pushed in any degree. And this is an important piece of doing a PICC dressing. Because remember, the PICC goes all the way up the arm, across the chest, and down in here. It's perfectly placed. So we don't want to be messing around with pulling in or out. It needs to stay exactly where it is. That's why we have these stat locks here. Okay? So first thing we're going to do is we're actually going to take off our current dressing or our current tegaderm that is on top. This can prove to be a little bit difficult because it is quite sticky. Now, when you are taking this off, make sure you are not touching anything inside of that dressing area. You are pulling back, being very careful. When you get to the insertion site, you are pulling gently and you are not pulling that PICC line out. You'll find on these mannequins that these tegaderms stick very, very well and might prove to be a little bit difficult. So just keep working at it. Okay, keep working slowly. If you need to pull against the tubing, make sure that you pull up. You can notice how sticky it really is. It does do very similar things on real skin, just to be sure. Alright, and then I get to the top here, I hold this in place, and I pull up. Okay. At this juncture, I am going to put on a mask. Okay, a mask will don my face. But for the purpose of this video and so that you can hear me, I won't actually be able to wear this. But at this point, you don your mask. And then we get our sterile field set up. So I pull this out, put my gloves aside, take my blue pad, slide it underneath the arm, just so that you know when you're doing a PICC change or a PICC dressing, you most likely will be doing it with a partner. Going to take my gloves off. And you will have learned how to open up a sterile field, hopefully in your 265 class. I just lost those. That's all right, I don't really need them for this dressing. It goes to show how quickly you can lose your sterile field. All right. At this point, I'm going to open a few things into my sterile tray. I'm going to open up some chlorhexidine wipes. Ensuring I'm very careful as I drop them in to my sterile field, that I'm not touching anything else, that they are not touching my hands or anything else. I'm opening them away and ensuring I know exactly where they're falling. I'm going to drop an alcohol wipe in there and another alcohol wipe. I am going to drop my tegaderm in there, and I am going to drop my stat lock supplies as well. Okay. At this juncture, I'm going to don my sterile gloves. go. Looping my hands inside. There we go. I've got all my fingers in. Beautiful. Grab this. Sterile. All right. Now remember, everything inside of this area is sterile, and everything inside of my group, my dressing here, is sterile. So I can touch anything inside of here now. All right. What we're going to do is we are going to try and remove this stat lock area with a little bit of alcohol swabs, or you can use chlorhexidine, but it is quite difficult to remove. So just ensure that you are loosening up this sticky piece with that alcohol, ensuring that you're not going close to this incision area. As we remove, being very cognizant and then discarding, grabbing my next one on the inside here. Now remember, you'll be doing this on a real person, so ensure that you are speaking to them, talking to them. Someone has actually stuck this quite nicely onto our dummies, so remember that just because it looks this way on a dummy does not necessarily mean this is how it's going to work on a real person. Okay, so at this point we're going to unlock that and unlock here as well. Okay, and here we have actually put a piece of tape that has come in our supply box, but there's already a piece of tape here to ensure that this does not move. So as we remove this from the stat lock, we continue to pull and remove from our patient. You'll notice that the stat lock also says do not remove, or I mean to remove with alcohol. Okay, so again, being very careful about what you are moving and not moving on our patient. And there we have removed the stat lock, and we discard that. At this point, we start using the chlorhexidine. And we start from the center and we clean around, over, around, over, around, flip over, around, around, under, around, throw it away, grab another one. Start here, clean to the skin, around, over, around, flip it over, use the other side, and cleaning, trash, and then we're going to clean from here down, swipe, flip, swipe, throw away, And one more. Clean down. One swipe, flip it, and clean down. One swipe, throw it. At this point, we're going to let everything dry. Make sure that everything dries by air. You do not blow on it. You do not fan it. You just let it dry. Inside of our sterile field, we actually have skin protectant prep pad. This is an important piece before you put your stat lock back on. Once this whole area has dried, you will be taking your skin prep and cleaning where the stat lock will be. Cleaning, cleaning, cleaning. Making sure that this is actually your skin prep, and that's what you are prepping, okay? It does act as a barrier for how sticky. Remember how sticky our stat lock was when we go put on our stat lock. Now we are ready to put our stat lock on. Just be sure that that skin prep may make your fingers a little sticky. All right. You'll notice that there are two areas to pull from for your stat lock, as well as arrows. Remember that the arrows always point towards the insertion site. So when you're putting your stat lock on, towards your insertion site. How you will do this is you will lift gently and place inside of there. Then you will grab one side, securing, pulling that away,